Welcome to today's webinar, highlighting promising practices to increase access to care for agricultural worker families, brought to you in collaboration with the Agricultural Worker Access Training and Capacity Building Advisory Group. And these are our learning objectives for this session. There are three things we hope you'll be able to do by the end of this session. First, we want you to be able to identify two promising practices implemented by health centers to improve access to care for migratory and seasonal agricultural workers, which we will refer to as MSAWs throughout the rest of the presentation. Next, we want you to be able to describe how these practices address common barriers faced by this population. And finally, we want you to be able to explore ways to adapt and apply these strategies within your own organizations to enhance service delivery for MSAWs. So to start, I'd like to tell you a little bit about the Ag Worker Access Training and Capacity Building Advisory Group that we worked with to make this webinar possible. The advisory group is comprised of representatives of health centers, health center networks, primary care associations, and other organizations that serve MSAWs. The group has been convening on a monthly basis since 2015, and their focus areas are listed here on the slide. The group focuses on understanding and addressing MSAW's unique needs and the challenges they face when accessing healthcare. Also ensuring health center staff receive high-quality training and technical assistance to do effective outreach with MSAWs and accurately identify and classify them in the Uniform Data System, or UDS. Also supporting development of collaborative relationships between health centers and other ag worker serving entities. And last but not least, identifying and disseminating promising practices for increasing access to care for MSAWs and their families, which is what we're doing here today. Another NCFH program that is integral to today's session is our Increased Access to Care for Ag Workers program, also established in 2015. What started as a training program has grown into a nationwide network of health centers, health center controlled networks, and primary care associations committed to training, action planning, UDS data tracking, and exchange of strategies to increase access to care for MSAWs and their families. So as we worked with these groups over the years, we found that one of the most valuable outcomes was this exchange of strategies. So we wanted to elevate these promising practices. And in 2018, NCFH launched our annual IAC Promising Practices Awards as a way to recognize health centers for these replicable, out-of-the-box strategies that they were doing and share them on a national basis. And our final program involved in this award is the NCFH Commemorative Artwork Program. Each year, NCFH commissions an artist to depict an image of the ag worker experience, and proceeds of sales of prints, posters, and note cards fund our Promising Practices Award program, as well as our scholarship program. So we encourage you to take a moment to view our commemorative artwork webpage and learn more about this program. And I am honored to introduce our 2025-2026 award recipients and showcase them today. So congratulations to Adelante Healthcare, based in Arizona, and Columbia Valley Community Health, based in Washington State. Both organizations were recognized at NCFH's Fall 2025 and Spring 2026 Agricultural Worker Health Symposia, respectively. And here today to share about their promising practices are Brenda Cardenas, Community Programs Director at Adelante Healthcare, and Dulce Negrete, Clinic Manager at Columbia Valley Community Health. We will drop their website info in the chat so you can learn more about these awesome health center organizations. And Brenda and Dulce, we thank you both for being here today to share about the great work you all are doing, and especially for your commitment to the MSAW population. And now, Brenda, I will hand off to you, representing our Fall 2025 recipient, Adelante Healthcare.
Thank you, Lisa. Again, my name is Brenda Cardenas. I'm the Community Programs Director at Adelante Healthcare. And one of the programs that is under our department is the Agricultural Worker Program, where we get to connect with migrant and seasonal agricultural workers, and also to outreach and connect with other partners that are also addressing care and other challenges that our agricultural workers have. You can go to the next slide. So just to give a little bit of history about who we are, so we started back in 1979. It started actually a little bit before then. It wasn't until 1979 when we got our 330 grant. But when we first started as a community health center, we primarily were working with outreaching to migrant and seasonal workers who had a lot of barriers to accessing healthcare. Around that time, in the El Mirage Surprise area of Arizona, most of that area was all fields, and there was no community health center or doctor's office nearby. And the nearest thing around that area was a hospital that oftentimes would just treat and release individuals that didn't have health insurance. And so there was a group of individuals that got together and said, like, we need to make a change. We need to provide access to healthcare to these individuals who have hardships with getting just basic care that they need or dental services. And so that's when they applied for the grant and were able to receive it. But since then, we've grown significantly. Now we have 9 community health centers throughout Maricopa County. We serve about 85,000 unique patients every year. And we have comprehensive sites that offer more than just primary care services. If you can go to the next slide. So our four of our current locations are fully comprehensive sites that offer all of the in-scope services that Adelante offers. So everything from primary care services to women's health, dental, behavioral health services. All of our locations also have on-site lab services. WIC is at all of our facilities. We also offer eligibility services at all of our locations to help our families apply for different resources or community programs that are available. The next slide has our other 5 locations, which are a bit smaller, but they still actually offer the majority of our Adelante services. Our comprehensive sites are a little bit bigger, so we can accommodate more patients. We also have community rooms at those locations, so if we need to open it up for community events or partner meetings, things of that nature, we always encourage our partners to utilize those larger sites for that integrated work services. But our other 5 locations still offer a wide range of services to our community. Next slide, please. So our migrant and seasonal agricultural worker program consists of a lot of community outreach. We work really hard to build relationships with the workers. We do this by doing a lot of field visits. We try to participate in as many local events as we can, because what we want to do is ensure that we become a familiar face. We can build that reputation that we want to integrate with community events, and that they know that they can call us whenever that they need services. We do a lot of collaboration with different agencies in order to be successful in this. So Adelante has had an incredibly successful relationship building with our state monitors. For years, this has been one of the ways that we can build strong relationships with the agricultural workers and with different farm growers. We also have a strong partnership with our different migrant education schools, with the state director that oversees this program as well, so that anytime that they have events with the schools, with the parents, with the community, that we can participate in those as well. And there's a few other agencies that are here in Arizona that also do a lot of outreach to agricultural workers. And so we kind of piggyback off of each other. We provide a lot of health screening events. All of these are free health screening events to just provide some baseline readings. Like we'll do free glucose checks, free blood pressure checks, and health education. And then one of the other things that we've been able to do the last few years is kind of identify what are some of the gaps and needs that different farm workers need, and that we can provide them support with. For example, some of the areas that we outreach to are a bit more rural, where even finding a grocery store or even a dollar store nearby is not nearby at all. And so what we do is we like to provide hygiene kits to these areas where we know that the agricultural workers are going to have a harder time getting things like soap and toothpaste because they don't have transportation. There may be some language barriers, and maybe even utilizing services like Uber is just not a reasonable um, um, resource for them. So we bring these items to them. We try to also bring practical items like cooling rags. In Arizona, we have a very, very dry heat. And so having cooling rags available, water bottles, hats, sunscreen, those are essential things that we always like to bring when we do outreach so that they know that we care about them more than just trying to get them to have a healthcare visit. Like those are important things to us, but we want to take care of the whole person. Next slide, please. We also try to bring our other programs to supplement the work that we're doing with our outreach work. So I mentioned earlier that all of our facilities have eligibility specialists. These eligibility specialists will also travel with us whenever we do outreach events or community events with our agricultural workers. And what they will assist with is they help with on-site services with applying for our sliding fee scale program. That way, when we're doing our free health screening services with the agricultural workers, we get them enrolled in the program so that when they need a more comprehensive visit at one of our facilities, we already have them enrolled in our program. They don't have to worry about any additional paperwork. Some of our families also qualify for our state Medicaid program, which in Arizona is called Access, or maybe their children qualify for those programs. And so, again, we provide this service on site wherever they're at. Their team is mobile so that we can help them with all of the data entry, documentation that they need to provide to the state so that we can really facilitate that process for them. That includes also applying for the CHIP program, which in Arizona is called Kids Care, or applying for nutrition assistance, or if they qualify for the marketplace, we help them with that process, with helping them to understand what their health coverage options are, and if they are eligible for a marketplace plan, how to utilize those health plans, how to schedule appointments, how to find who's in network and maximize the use of those programs, and then any additional resource referral that they need. One of the things that our team recently started to do is we can now help with utility assistance with paying for their electric bill or other services. And so we help to facilitate that process and identify what other resources they may need that we may be able to connect them with. Next slide, please. We also have a maternal and child health program through a grant that we received through the state where we can provide parent workshops. We do community baby showers. We provide education on the Safe Sleep program and the car seat program. And we also provide them the supplies that they need for these programs. So when they participate in the Safe Sleep program, we give them a pack and play. When they participate in the car seat program, we give them a car seat as well. We also have a diaper distribution program that's available through some of our sites. So again, when any of our agricultural workers let us know that they're lacking or they have a need for any of these services, we ensure that our maternal and child health program manager is tied in to all of their needs and provides that support. Next slide. And we do a lot of outreach, a lot of outreach. On average, our team, which is pretty small, but we do about 30 events a month. We participate in health fairs. We host our own site resource fairs as well. That's really important for us is to be able to not just go out into the community, but also bring the community to our facilities. Um, we do this through events like back to school events, or in the fall, we do an event called Boo Bash. In the spring, at some of our more rural sites, when it's cooler in Arizona, we do outdoor spring fling events where we invite the community and our agricultural workers to come out and visit with different vendors that have other amazing resources that are available to them as well. With our hosting our events, one of the things that we've been able to do is collaborate with some of our agricultural partners to do events at the farms. And that has come from building a lot of trust and a good reputation with the growers. And so they allow us to come out and bring other vendors to come and share their resources with the ag workers. Next slide, please. We also have an amazing community health team. that provides a lot of free health services to our community. So I mentioned earlier about some of the free health screening events that they do. They do a lot of great patient education. So again, we try to look at what are some of the needs in the pockets of communities that we're serving so that we can ensure that the education, patient education or community education we're providing is what that community truly needs. They are very busy with a lot of vaccine events. We try to get ahead of the game. So, like right now, for example, is a time in the summer where we start doing outreach for planning for our flu season. So we start connecting with the different farms to say, hey, around this time is when flu season is going to be active. Let's start putting it in the calendar when you want us to come out so that we can ensure that we order the right amount of vaccines, bring the right resources to those events as well, to get everyone in our community vaccinated. We also have an internal HIV program. And so we'll bring them to some of our events as well so that they can also provide HIV education to those events. And we have been working with our medical team so that we can also start providing child check events with some of our migrant education schools that we partner with. We're working on providing well visits on the fields as well with the mobile unit. So we're working on expanding the work that our team can do. It's a small team, it's a team of 5 individuals in total. So oftentimes we have to get resources from our sites, get volunteers from our sites to come out to help us to ensure that we can maximize the reach when we are able to go out to the fields. Next slide, please. These are just some of the pictures from us going out. I think pictures often speak more than words. We work with a lot of farms that are like producing melons, cilantro, all kinds of amazing vegetables and fruits that are here in our community. There's a lot of misconception that because it's so hot here, things don't grow, but that's not the case. Year round, there's always something growing here. And so there's always a lot of work to ensure that all of our ag workers have access to health care. We want to make sure that they know what resources are available to them. The top, middle picture at the top is one of the examples of us having like a little mini health fair with some other partners that come out with us to share their resources when we're out doing health screenings. If you go to the next slide. And again, just more pictures of the work that we go out to do. We love inviting our leadership to come out to engage in these events as well and other community partners. Um, Inviting our leadership has been a very important part of the work that we do to ensure that they understand why this work is important and how beneficial it is to those that we're serving so that they can continue to support the work that we're doing. Next slide, please. Pictures are just never ending. The picture at the top left corner is just an example of some of the items that we get to donate to the workers. So again, we try to do practical things that we know will help them, like hats and gloves and bandanas or cooling rags, and any other hygiene products that we know will benefit them. We also invite board members. The individual with the ATSU shirt is actually one of our board members that works for AT Still University, who has come out to volunteer to help with registration and signing individuals in to get their health screenings. Next slide. And that's it. This is our presentation. This is part of our amazing department. So this is not all of our migrant and seasonal farm worker team. This is part of our community programs department team. And what I love about this team is that technically our team is a team of one. We have one farm worker coordinator that does all the outreach. And what he does is he identifies the need, the opportunities, and then we start pulling the different teams from eligibility, community health, maternal and child health. Even our advocacy team will come out and volunteer to help with all of these events. That's how we're able to have such successful events. That's how we're able to participate in 30 plus events every single month, is because even though it may not be quote unquote our job to do certain things, we all have the same desire to ensure that all of our communities have access to healthcare. I was sharing with Lisa earlier this week that what we've been able to do because of the integration and how we work together so closely with our partners is we've been able to build that trust and expand on that. So We had a farm that we've been building a relationship with last year that allowed us to come to their sites to provide health services, to provide vaccine events, and that relationship with them has just gotten stronger over the last few months. We then connected with a new farm earlier this year, had a very similar interaction. We talked about providing mammograms to some of their ag workers. Is now these two farms want to work together to say, hey, why don't we just co-host this event together and ensure that all of our women have access to free mammograms and continuous care and established care with a provider at Adelante Healthcare so that they know that when they're not feeling well or that when they need that extra support for themselves and their families, they know exactly who to call, they know exactly who they trust because their employer trusts us. And so we've just been able to see how these collaborations with community partners has just really strengthened our relationship with our growers, which has strengthened our relationships with our ag workers. And we've seen that growth and expansion just even in the last couple of years as we've been able to do even more work. So we're just really grateful to everything that our team does to contribute to this and to our partners that allow us to, piggyback off of their events and that they come to our events so that our reach just goes further than we could with just one individual that's assigned to this team. So thank you for the opportunity to present on this.
Thank you so much, Brenda. That's amazing. One person and but definitely teamwork within your whole organization. And I kept hearing the word partnership throughout, and that's definitely something when I think of you is those the partnerships that you all have developed, those strong partnerships. So thank you again for joining us. And again, for those joining us live today, you'll have an opportunity to get more information about Adelante's program and ask Brenda some additional questions at the end of this session. So thank you again, Brenda. And now we will transition to Dulce. Dulce Negrete, representing our Spring 2026 Promising Practices Award recipient, Columbia Valley Community Health. Dulce, I'll transition to you now.
Thank you. Thank you, and good morning on our end, and good afternoon on some of you. My name is Dulce Negrete. I'm a clinic manager with Columbia Valley Community Health. Today, I want to share how we have been working to increase access to care for migrant and seasonal agriculture workers. More importantly, I like to walk you through what's actually worked for us, our partnerships, our systems, and the lessons learned along the way for sure. To start, let me briefly tell you about who we are. So, Columbia Valley Community Health, we're a federally qualified health center serving North Central Washington, established early 1972 by a group of 24 concerned citizens that came together in a restaurant and, wanting to address the need in our valley. Since then, we've grown through several locations, serving, of course, in, Chelan and Douglas County. Our goal is simple, is to make care accessible for our communities where they need it the most. We don't rely on just one model. We meet people in different ways through outreach in schools, using our mobile clinics. On this map, the blue pin represents the migrant and agriculture workers. And then you can see, of course, the other pins on how we do within outreach. We serve through Girls on the Run programs. So we reach out to the schools. Then we address our unhoused population as well as our agriculture workers. So how we do this actually, how to reach across the large area is, of course, our mobile units. We started back being very mobile with tents. We still use tents. We use our mobile units when we can, and there's space available for us to come, and we use our mobile unit when that space is very limited and reduced. We bring care directly to our community. That means farms or camps or schools. We go out and we find those gaps on the community. No location is too remote, is what we like to say. And that has been key for us. We're not just there doing screenings, we provide real comprehensive care. And because everything is mobile, we can be more flexible around people's schedules as well. But mobile clinics only work because of the people behind them. If we can go to the next slide. As Brenda had mentioned, our team also is a team of two, but we can do this, with partnerships through not just our organization, but also partnering with our schools and finding volunteers and partnering with our local colleges to see if there's students that are able and willing to come out and support us. Um, it's a full team effort. Our outreach coordinators build the relationship and make things happen. Promoters connect with patients using a community health worker model. Our providers and our medical staff deliver the care, of course, and our transportation team literally keeps us moving. So one of that mobile unit is quite big, which does require a CDL. So we do have per diem drivers that help us transport the big mobile unit. Plus, our partners and volunteers expand our reach and trust. If you can, so go to the next slide. Now, to understand why we do things the way we do, it's important to understand the population we serve. Um, migrant seasonal workers have a very unique reality. They work in is their work is very mobile and also very seasonal and very time sensitive. Many have limited English proficiency. Transportation can be one of the major challenges. We can go out there and say, gosh, because some of the services that we can provide out in the field is limited, and we say you really need to come into the clinic, that right there, we lose them. So trying to find, working with their foremen and working with other local organizations that can provide that transportation is really key. So once you hear the conflict or what their barrier is, coming prepared to where we have a solution for you is very important. And their work schedules obviously don't align with their clinical hours as well. So, finding a way where we can be there and serve them, after hours is very important. So all of these creates real barriers to care. So transportation, again, distance are a big barrier. They can fear and mistrust the system. Insurance is often limited or confusing. They don't want to have to pay anything out of pocket. They're here for a temporary time. They work very hard for their money. And that belief is real, right? I can always go home and just get the services much quicker. But after they see their provider, our provider's like, they don't have a lot. They should not wait. So finding those and being very upfront with them, just saying, we can provide better care at the clinic if you were able to or willing to make that sacrifice. And again, coordinating with their foremen has been very important with us as well. And along work days, leave time of care. So on top of that, environmental conditions like heat, smoke impact both health and access. And of course, our winters here are pretty intimidating as well. So we try, if they're out there working, we're out there working with them alongside them also to be able to provide that support. So instead of expecting patients to adjust to us, we adjust to them and their needs. And we do this by, again, bringing the clinics directly to the work sites, the camps, the schools. We align our schedules along with the agricultural seasonal workers. We made sure that we had bilingual staff who are trusted in the community. Our outreach staff are embedded within where the people that we serve. And we focus heavily on following up and making sure care is completed. But we obviously don't do this alone. If you can go to the so partnerships are really the key foundation for us to be able to go out into the community. We partner with our Department of Health, with local and religious organizations. We collaborate with schools, with growers, community organizations, migrant camps, and faith groups. These partners help us connect with people in the ways that we couldn't do it on our own. And these partnerships didn't just appear. It took time to build. We started by listening, not just by offering services right away. We showed up consistently. We started by pilot efforts. And most importantly, we followed through when we said we were going to do something. So we said we were going to be there. We showed up. And we didn't show up alone. We did surveys. So we said, we ran needs assessments, and sometimes the healthcare wasn't their high priority. It was food insecurities, having clean clothes, just having a water bottle the next day that they were going to have. We purchased um, um, lunch pails so that they can take their food and try to keep it, at a decent temperature before lunch. And that took time to build that trust. One of the most important partnerships we built is, with our agricultural workers, and just explaining that we were there to support their employees. Employers quickly saw the benefits. On-site clinic reduced missed work time. They improved follow through for care. And over time, employers became allies in supporting workers' health as well, where we saw someone calling us, are you coming back this year? So now let's share a few particular things that make this work operationally. Clear communication is everything. We make sure that everyone knows what services we're going to offer and what partners are going to come with us on that visit so that the employer is aware, all the different cars that are going to be pulling up, what time we are going to be serving their employees, and what time we're going to be leaving as well. So we coordinate between outreach and the clinical team as well to make sure that they, tight, clear communication. We provide on-site support for insurance eligibility as well. We also prep them, hey, if you do need to come to the clinic, these are the steps that we're going to follow and what to expect, because obviously services that they received out in the field may be slightly different than what they receive when they come into the clinic. But over time, we've learned a few important lessons is that we need to be very upfront. Don't overpromise. Communication has been the constant. Even if we set up a time with the grower, maybe 6 months ago, we want to obviously let them know, hey, in 3 months we're coming, and in 2 weeks we're coming, and then obviously we follow up with flyers so that they can just let them know that we're going to be there and what time we're going to be there. Just trust takes time, but it's worth it. Flexibility is non-negotiable with this population. We can't expect there'll be days that we'll be there 2, 3 hours, and we won't see a single soul. But at least we delivered the information. We left the swag items. We let them know, hey, we're coming again on this day. Is this still a good time for you? We just need to be flexible. And our community partners also need to understand that, there might be a group of 45 that come and then the next time there might be 3, 4 that show up to receive the services. So, what does that mean for others doing the work? Align your operations with your goals easily. Know where your migrant seasonal population is. Build those partnerships before launching. Don't just show up, even if you have the great setup, the best setup. If they don't know you're coming, all you're going to do is scare them. They're going to wonder what you're doing there. So even though the aspect of surprise is not the best approach, is what I like to say. Again, build those partnerships before launching, and invest in an outreach team coordinator that focuses, that has the heart, that has the right mindset. It makes everything possible. You have to have the right personality, because outreach does tend to be a solo person operation. But if they don't have the right personality, right, we're having to build this team to go out into the community, and you can't do it by yourself. So I'll close with this. When we intentionally design care around the community, patients get the care that they need, our communities are healthier, and the health centers meet their goals. So, if anything here, I can say, if you definitely reach out to other community health centers, see what they're doing. You might find yourself like, you're doing a pretty good job, but you can always learn, like I've learned today from our other speaker as well. Um, we're here to serve our community. So thank you so much for this time.
Thank you, Dulce. Another great presentation. And now I will pass the presentation over to our colleagues Cindy Selmy from Health Outreach Partners and Alexis Guild from Farmworker Justice, both representing our Ag Worker Access Advisory Group. Thank you both for joining us today, and we look forward to the Q&A.
Thanks, Lisa. I'm going to kick us off. If anybody has any questions, feel free, one, to unmute yourself and just ask it live, or you can drop it in the Q&A, and we will answer them. But to kick us off, I am going to ask, this can be for either Brenda or Dulce, but I'm interested to know how your relationships with growers and farms and employers has evolved. And how do you nurture these important partnerships? And how might you have addressed challenges that come up? If somebody wants to go ahead and start, how about Brenda?
Yeah, I can start. Um, so for us, like I had mentioned earlier, what we've what we've seen is the trust with some of these growers has grown so much that we're now able to collaborate with other growers for some of our health screening events, which is very exciting for us to do. Um, the way we've been able to get there is we like to do periodic check-ins with the growers. So there are some growers that we work with based on the season that we know they're going to be busier. And so as the season for that busy time is approaching, we start scheduling check-in meetings. Our farm worker coordinator will actually just drop in sometimes and just to say hello, bring more business cards or flyers, and say, hey, don't forget we can schedule events with you guys, or don't forget, I can help with this. Those touch points are extremely beneficial so that they don't forget that we're still here for them. Some other growers that we work with do year-round services. It's not really seasonal, it's year-round, they're busy. And so with them, we do either a monthly check-in or more like a quarterly check-in. Sometimes we kind of pre-plan our year, like, okay, we already know that we're going to be here in November for flu season, and we're going to come in October for a mammogram event, and we're going to come in July for health screenings. So it kind of just depends on each grower individually. When we've encountered issues, um, we make sure that we're as honest as possible. We never promise to provide something we know we can't provide. So we provide free health screenings, but that doesn't mean that everything is free. Perfect example is we're planning a mammogram event with two of the farms we work with in the next few months. That's 100% free, and they know that. But part of the requirement with the funder is that they have to have established care with a primary care provider, which for us is wonderful because we want them to be our established patient. That means that we now have to ensure that they're either enrolled in our sliding fee scale or something else so that we can establish that care. And so once they're in the sliding fee scale, there is a nominal fee that gets tied to that. And so we're very transparent with the grower and the patient. This is coming up so that the cost doesn't become a barrier for these individuals, and we can avoid issues of the cost part in advance. Um, but that's what's worked for us.
Thank you. Thank you for sharing. Dulce, do you have
Yeah.
anything that you would like to add?
Yeah, I think again, just being very transparent. We've had our falls with our because we show up with too much, or we show up in an area where our mobile unit is pretty big and their semi trucks are pretty big. So we've lived and learned. So again, very open communication, having us checking out the site so that they know where we're going to be parked. And then we are the ones that need to be flexible when it comes to, we also serve our warehouses here. So again, flu season is in October. And we let them know, hey, can you let them off the line? And it'll be 3 minutes. It'll be very quick. And we have a workflow going and we're very transparent. We're going to arrive at this time. This is how long it's going to take for them to sign. This is the vaccine, and they'll be back on the line in 5 minutes. And we have to honor that and just be very, again, transparent. If we do have other organizations that reach out to us and say, can we come with you? And I said, we need to run it by our grower, make sure that we're very transparent. And that I think transparency is key. And also keeping in mind that our Chelan and Douglas County agriculture has reduced year to year. There's a lot of partnerships that are happening, other larger organizations that are taking over, and it's very high now H2A workers, which again, they work for the season, and they want to go back home. So there's a lot of that reluctancy, if you would, to come into the clinic and having to spend any of their money that they've, worked so hard to earn to have it and spend it here. So again, allowing us to explain, hey, when we come here, this is a no cost screening. However, if you do need to come to the clinic, then we prepare you for that and what that would look like. So I think key with everything is transparency. A key service that we do bring, we partner with our food banks, and then we bring out the food with us. And that, just letting them, hey, we're bringing clean t-shirts, we're bringing coolers for you, we're bringing this and that. And the foreman usually, usually the foreman has been a migrant seasonal worker from a young age himself, and he understands the needs. And therefore, if we explain everything that we're coming and we're bringing to them, he's more open to having us come on the floor.
Awesome. Thank you for sharing.
Mm-hmm.
Alexis, I see we have a question in the Q&A. Would you like to read it for us?
Absolutely. So we do have a question, and Dulce, I think this question is for you, since winter is more of an issue in Washington State than Arizona. So the question is, what does a typical winter day look for, or look like, with the mobile van and trailer?
Yeah. Just like the heat, we have 15-degree weather in the summer, and we have negative weather in the winter. So we bring our mobile unit, we crank up our heaters, and they're out there. We should be out there as well as what we say. So we bring out our mobile unit and we bring our provider, very similar to a very hot day. We change it to making sure we're handing out gloves, we're handing out hoodies, we're handing out, things that would keep them warm out in the winter. Again, we educate on the importance of, staying warm and staying hydrated as well in the winter, and also applying sunscreen and just being safe when they're out there in the field. So very similar, just the temperature is what changes, I guess, if you would.
No, thank you for sharing that. And it made me think about the summer as well, since you talked about heat. So I don't know, Dulce and Brenda, what your thoughts are around providing those services, the health fairs, the mobile clinics during the heat of summer, especially in Arizona, but also in Washington State, where it can get quite warm.
And smoke and fire. We call it,
Yep.
we have the fires all the time.
Yep.
But yeah, just the education changes, the services that well, obviously the dental screenings and the medical and behavioral health services, those don't necessarily change, but what does change a lot is the education that we bring out. We see a lot of heat strokes and just, a lot of injuries from the ladder because of that. So we bring ways that they can keep hydrated. We bring water bottles. We bring certain things like that to apply to the weather.
Yeah, I agree with Dulce. We just kind of adapt to our education and our supplies that we bring based on the weather. So a perfect example was yesterday we had a farm event. It was late in the evening, or late in the afternoon, but it was, I believe, about 108 when we arrived. So what we did for our team is we've pre-purchased a couple of swamp coolers that we bring with us. They don't help a whole lot, but they help enough so that when the team needs a little bit of like refreshment to cool off a little bit, they stand by the cooler and cool off. We also, what we do for the farm workers though is when we're doing the health screenings, the nurses and our providers will provide education about heat-related illnesses. Our goodie bags will include hydration packets. Every single one will include a hydration packet, cooling rags. We'll check in with the staff if they need those items. We usually, when it's really, really hot, we carry a cooler just with water and ice that the team can refresh their cooling rags in as well so that we can ensure that their health and well-being is okay. And as much as we possibly can when we're working with the growers, sometimes it's possible to have like a community indoor space where we can plug in our coolers to try to keep the temp a little bit lower. But we always want to make sure that it's safe enough for our team to work because we don't want our own team to be passing out while we're trying to provide education on heat-related illness. Not to mention our devices will also stop working if it's too hot, which has happened to us. There's been times it's so hot that our blood pressure cuffs will just completely stop working. So we just look at we try to look at circumstances, location, and what supplies we can bring to make the situation a little bit better.
Yeah, glad you mentioned that because yes, anytime that we can find an indoor space, beautiful. That's just like the golden, but we
Mhm.
know that it's not always possible. So then we bring our mobile unit. But again,
Yeah.
because it's so hot, it'll stop working. The generator will
Yes.
stop
The
working.
generators would work.
So then we have our van, and it's awkward, right? To ask a grown man, can you jump in the back of the van? And we do the same thing. So we go back to tents, and tents have, seem to work the best. And like you said, we try to do misters, we try to do
Mhm.
things to try to just to keep the environment somewhat tolerable for both our staff, and our patients as well.
I think that demonstrates the adaptability that's required when you do outreach, especially when you do outreach to agricultural workers, because the circumstances can vary so much. And
Mhm.
you have to respond to those circumstances as much as the workers have to respond to those circumstances.
Mhm.
Um, I am wondering, also, Dulce, you mentioned H2A workers, and there are a growing number of H2A workers across the country. I'm sure everyone on this call are seeing more H2A workers in their service areas. I'm wondering if you have any strategies specifically for H2A workers to do outreach. They are more challenging to reach. But also just thinking more broadly, just in this current environment, um, what are some, successful strategies that you've deployed in order to continue to connect agricultural workers to healthcare, just given everything that's currently happening and all that our communities are encountering at the moment?
Like you said, it's been challenging with H2A workers, especially because they're so mobile. With our in our counties, they share the group. They jump from orchard to orchard sometimes, so we'll run into the same employee throughout our migrant camps. But it is challenging, like you said, because they if it's going to cost anything, they don't want to follow through. But just having, them understand that this is a screening, this is a touch point. We're not here, especially when we're out in the field. And then we do explain, hey, if you do have to come to the clinic, then it would be a little bit different. And then we try to again keep it very open to the communication where we'll run the slide, we'll see, what you qualify for, and then more often than not, they'll say, no, I'll just wait till I get back to my country and I'll get it looked at then. But it's been challenging in that sense where getting them to open, especially when it comes to behavioral health services, that has been one of our challenges because once they start talking to the provider, the tears start rolling. And then we say, okay, we really, should see our behavioral health and we'll bring them out with us. Same thing with our dental screening. But just getting them to open up, sometimes it does require 1, 2, 3 visits and we may not be coming back to that camp. So it's always, again, giving them this is what we're going to be offering and this is when will we be back if we're going to be back. So taking advantage of those resources when available has been really important for us.
We've had we've actually had a little bit more success with connecting with H2As, but I really strongly believe that that's because of the relationship we have with our Arizona State monitors. They take us everywhere. I mean, on a weekly basis, there are times where on a single day we'll go to 2 or 3 different farms with them, and that's 2 or 3 days out of the week that we're outreaching with them, and that really has allowed us to get in front of a lot of H2As at any one given time. The challenge that we do have, very similar to Dulce, is the follow-up or the comprehension of the needing to get a little bit more care than what we can provide when we're physically there. Even when we offer transportation to a nearby health center, or we offer to waive the fees for, the nominal fee for the sliding fee scale program, there's still some hesitancy because we'll hear the same thing. Well, when I go back home, I'll take care of this. So that usually is our biggest challenge with getting them to come back. But to get in front of them, to be able to connect them to at least our mobile services has that for us has been successful. But I firmly believe that it's because of the relationship that we have with our state monitors.
Thank you. Thank you, Brenda. Thank you, Dulce. I want to ask, I'm going to shift gears, and this will be our last question. Both of you have really built out outreach programs. They have lots of activities and it's very well integrated, it sounds like, into your health center program. And one of the programs that my organization, Health Outreach Partners, strives for is to bring integrated outreach into community health centers. Can you tell us how your organization evolved to this point to have outreach be part of your day-to-day operations that is just seamlessly integrated into your health center's work?
I think with us, we started with outreach. It's embedded in our organization. It has fluctuated. I've been with this organization for a little over 10 years, and it's changed in a way that we get a lot more support when it comes to staffing, when it comes to financial and just overall, we get more support. But I think within outreach too, we do our due diligence to be able to find, certain funds. I think depends on your organization, and every organization is different, but it's just part of who we are. Outreach is how we started. It's been with us this on, and I don't see it really ever going away. It's changed and we've evolved, but even though we started with just seeing, migrant agricultural workers, now we're in the schools, we're seeing our on-house population. We are serving those, what we consider the underserved population, right? That there's that gap. So it's just changed, but I don't ever see it going away. And our board and our executive team are very supportive of outreach and yeah, steady.
Awesome.
I don't
Can
know
I
what the
ask you,
term.
before we go to Brenda, can I just ask a question? In your state, in Washington, is community health worker services or any outreach covered by your Medicaid program?
Um, It's not a money generating program. Let me tell you that. It definitely costs money, but it's very supported by our community partners, is what I should say. I think what comes out of our pocket is not as much when we partner with other organizations in our valley. When we put together our back to school health fair, where a lot of our migrant population comes to these events. I mean, there's 40, 50 people that are organizations that are showing up, giving us money so we can put a amazing event together. When we partner with our food banks, we're coming with an array of food that we couldn't put it together as an FQHC. But, through these partnerships, we are building these relationships so that we do not show up empty-handed to these events that we're putting together. We are internally into our three of our 10 sites have food banks in them that are funded not by us. This is free food that we receive by our local Chelan Community Action Council. Again, but if we had to pay for them, maybe that would be a service that we wouldn't be able to provide. But they bring it to us, they package it, they give us boxes, and we hand them out to the community. They don't have to be our patients. So I know we're kind of going off, but through these partnerships is how outreach has been able to continue to thrive within our counties.
Excellent. Thank you for sharing that. Brenda, you'll have our last word.
Yeah, I was getting excited when she was talking because like that's a lot of what works for us is I do think that the outreach is just part of our culture here. And it has changed over the years, and we've had to get creative because just like everyone else, funding is always an issue and it will always be an issue. But that doesn't mean the work stops. We just have to get creative. So when I mentioned earlier about we have one farm worker coordinator right now. For 2 years, we had no farm worker coordinator. It was just me plus managing other things. And so we knew that that wasn't going to stop us or slow us down. And that's when we had to get creative of, all right, we're going to use eligibility and outreach team to help with this. And we're going to use mobile health team. And then we're going to bring volunteers in and we make the work continues. Um, and I think the other piece as well, which Dulce also mentioned, is the when your board and your leadership believe in the work and they're aligned with the work, um, it makes the world of a difference to being able to continue to do what you do. And so this is why we invite them to come out to those outreach events with us. And they know when they come, when they volunteer. One of our chiefs came out yesterday, and I told him, you're not just going to be in a picture, you're going to help with registration. And he did amazing. It was his first time coming out, but he enjoyed it thoroughly. So now he can take that feedback and share it with our executive team of this is the experience, this is what the outcome was, this is the number of individuals we served, and so on and so forth. And that just continues to strengthen our outreach team and our outreach work. And the partnerships as well. Without the strong partnerships that we have, we wouldn't be able to do a lot of the outreach work we do. They invite us, we invite them, and it just the reach expands much further than if it was just one of us individually doing it.
That's
Mhm.
great. Thank you for sharing. I could sit here and talk to you both all day about your work, but we are out of time. So I am going to pass it back to Lisa to close us out.
Thank you. Thank you all. This was just, I love this conversation that happened. Thank you, Cindy and Alexis, for excellent facilitation, and Brenda and Dulce, excellent presentations, and love that we had the opportunity to gather some more information from you in the Q&A. I think that's such a value, and really the intent of us sharing these promising practices is to learn from you all. And for those of you that are participating as attendees, please share your promising practices as well. These are two examples, but we know that health centers across the U.S. are doing such excellent work, and all these out of the box things are the things we need to hear about. So thank you all for your time.